Hello, ladies and gentlemen. Welcome to episode 2 of PGIM India Mutual Fund presents LiveMint, Amend, Adjust and Adapt. This is a series of high-powered discussions and analysis where we're trying to look at various success mantras in what is likely to be the new normal in the post-COVID world. Now, I'm Vikram Chandra, founder of Heritage. Today, we're going to be looking at the topic of health and well-being. And obviously, in the middle of coronavirus, I think all of us are thinking about our health a lot more than we ever really want to be doing. But it's not just COVID. There are lots of other aspects of it that we should also be thinking about and talking about. And some of those mantras are ones which we're going to try and get from our panel of experts today. How do we deal with the situation? How do we deal with being in the house? How do we deal with any mental stress and tension that we may be facing? How do we make sure we are eating correct? So lots of aspects of this, and I'm going to start off straight away by diving in by introducing some of our very special guests out here. Rujuta Diwekar is India's leading nutrition and exercise science specialist. Thanks, Rujuta, for being with us. Dr. Samir Parikh, eminent psychiatrist and director of the Department of Mental Health and Behavioural Sciences at Fortis Healthcare. And Ajit Menon is with us, CEO of PGIM India Asset Management Private Limited. Thanks all so much for being with us right now. But first, let's just hear from one of the people who's been leading the battle against the coronavirus in India, Dr. Randeep Guleria, Director of AIIMS. Sir, it's a pleasure to have you with us, and just wanted to get your sense of how we are actually doing. Look, we know that the cases have risen a lot. Every day, it seems to be almost like a new record number of cases, but fatalities seem to be still well under control, I guess is the best way we can put it. What is your sense of how India is dealing with the coronavirus?
So I think as compared to countries in the West, we have done well. We must always remember that the cases will increase considering the size of our population. In absolute numbers, if we were to look at it in number of cases per million population, we still are pretty low. And I think we did a lot of things which were right to begin with. We had the lockdown very early, and that actually gave us time to prepare in terms of improving our healthcare infrastructure, whether it was really making COVID care centers, COVID hospitals, or COVID ICUs. At that point in time, we realized that one thing that is really going to make a big difference is having oxygen points. And a large part of India, this was something that was felt may not be there, especially in rural India or district hospitals. And a lot of attention was actually put forward in trying to provide good oxygen points and beds with oxygen 24/7 in these hospitals. We also then ramped up our ventilatory support. One of the challenges that we had in the early days, if you remember, was PPEs. There was a huge shortage of PPEs because of the fact that they were all being imported. They were all coming from China. And when you have a pandemic, there is always a demand from all countries across the globe for something which is coming from one area of the world. And gradually, I think we were able to get our Indian manufacturers on board. And now we have surplus of PPE. We are in a position of supporting PPEs. And the same goes true for testing. We started off with very little testing, very few labs, doing around 10,000 tests a day. Now we have more than 1,200 labs and we're doing more than 3.5 lakh tests a day. But still a lot more needs to be done, especially when we start looking at how the pandemic is behaving, going from metropolitan cities to smaller towns. And I think there is a lot of aggressive effort we need to do in terms of testing, in terms of containment, in terms of tracking, and especially in the tier 2 cities and in the rural part of our country. So we have done well, but there's a lot more to do.
So I just want to take you up, sir, on many of the aspects of what you've spoken about. Let's just first talk about the spread of the disease. Clearly, the first wave was in Mumbai and then Delhi, Chennai to some extent. Now, these are big cities with already fairly well-developed healthcare, and then a lot of additional steps were taken. We saw those big efforts to roll out beds in Delhi. So already good medical infrastructure, and then steps were taken to further bolster that. Where the cases now seem to be rising, okay, there's Pune and Bangalore, which would also have good healthcare. But when it starts spreading to Bihar, when parts of Uttar Pradesh, other areas where maybe the healthcare is not that good, and rural India, where again you may have a problem. So could there be a crisis then? And the numbers of deaths that we've been seeing, which so far are under control, could you suddenly start seeing fatalities rising a little bit then?
So I think that is where, like I said, we need to focus a lot. We've been doing that over the last few months, even looking at the district hospitals, the rural centers and seeing how we can not only upgrade them, but develop a facility where, if need be, a rapid hospital can be constructed there in no time. And this is something which has been done by DRDO and the Army. Also, how we can distribute our resources. So can we really send doctors to those areas where currently there is a shortage, and from areas where now the pandemic seems to have waned? So those type of strategies are also there in place. But I agree with you that the challenges are going to be different. We had a different type of challenge when it came to cities, because there was a very large population density. And although the health structure was better, but the number of cases was very, very large, because of the fact that we had the so-called urban slums, and a large number of people were staying in one room and were getting infected, and there was this huge spike in number of cases. I don't see we'll see that type. I don't think we'll see that type of a spike in rural India, because it's that type of density is not there. But the challenge, like you rightly said, is going to be to make sure that we are able to provide good health facilities and keep our mortality low. There's already been a lot of efforts done by that by the government, also working on strategies of what we call a public-private partnership, and getting hospitals in smaller towns, whether in the government sector or in the private sector, to become COVID hospitals and have all the infrastructure there, and then develop a modality of what we call EICUs. The doctors there, if they're not trained, they can have get advice from people or doctors who are specialists in cities, and they can help them in managing these patients who are critically ill, and thereby help in decreasing the mortality.
I just have to ask you about what you think about the nature of the curve that we are actually seeing in India so far. Because if you think about it, if you're talking about the flattening of the curve, Delhi perhaps seeing it now, Chennai, maybe Mumbai, certainly. But overall, as a country, the curve is really showing no signs of flattening or even reducing. The day-on-day growth rate, both in terms of total cases, is about 3.5, 3.6, and it's continuing to grow at 3.6 every day, which means absolute cases are rising. Even active cases do seem to be continuing to rise. So the overall curve, does it worry you that the total number of, we may have 2 million cases in India within like 25 days or 30 days, maybe 4 million another 1 month after that? Is that the way it's still looking?
So yes, the number of cases are still increasing. It's not that we could say that we've peaked as far as the country is concerned. But like I said in the past, that I think different areas in India will peak at different times, and therefore we will see a rise in number of cases. Some cities like Delhi, Mumbai, Ahmedabad, and some cities in the south have peaked, and you can see that there is a flattening or a decline in number of cases. But there are other smaller cities which have now started showing increasing number of cases. There are cities in UP, in Bihar, and in Assam, which are now showing increasing cases, which are contributing to the increasing numbers. So I think that is something that is happening, that the pandemic is moving from one area to the other. And this is not something new for India itself. It's seen in the United States also. It started off in New York, and now we're seeing a lot of southern states having a spike in number of cases. So I think we need to start focusing on these areas, do aggressive testing, tracing, have aggressive containment zones in these areas if we really need to prevent increasing number of cases in smaller towns and in rural India.
I wanted to understand, to just get your take on what you made of the serological survey that was just done, that seemed to indicate 23-24% of people in a city like Delhi have already been infected. Now, there are two ways of looking at it. If that number is correct and you extrapolate it for the population of Delhi, it means what? 50 lakh cases in Delhi perhaps have already been reported. 5 million cases have already been seen in Delhi, if that serological survey is something to go by. There are two ways of looking at it. That means that India is already seeing a very high number of coronavirus cases. That's the bad news. The good news, or the better way to look upon it, I guess, is to say, if that's really the case, then coronavirus is not as dangerous a disease as we may have thought. Because then if actually you have a situation where in Delhi, 50 lakh people have had coronavirus and only 3,500 people died, less than 0.1% of people are dying of coronavirus. So how do you interpret that serological study?
So I agree with you. There are two ways of looking at it. The first one is obviously that if we look at the infection-related mortality, that is not only the cases who are positive, but all those who got infected, and that includes those who are seropositive, the mortality is much, much lower than what we had thought of. And that really suggests that our mortality is actually really very low. And possibly we have a large number of individuals who have mild or asymptomatic disease and really don't get tested or become all right on their own, and thereby the mortality is much lower. But it also suggests that we have almost 73 or 74% of individuals who don't have any immunity and are still vulnerable. And many of them could be in the high risk category because of comorbidities and because of the older age group. And we therefore need to continue to be vigilant in terms of infection control, in terms of wearing a mask, in terms of social distancing, because all of these individuals have a potential of getting a serious illness. So there is still a need to be very careful. But the good news, like you said, is that it does suggest that in our country, the disease is much milder than we thought.
Of course, the other way to look at that even going forward is that mortality could be reduced, whatever the mortality rate is. And even if you're looking at the case fatality rate of 2.6 or whatever it is, we are now seem to be finding some ways of at least being able to treat the disease. So we're not shooting as much in the dark as we may have been doing in March. I mean, we've got some options like remdesivir and other medications that are available. You've got the possibility of dexamethasone in more serious cases. So that and plasma therapy perhaps. So do you think that's one of the ways in which we will actually tackle coronavirus? While we wait for the vaccine, doctors across the board will figure out, look, don't worry about it. If people are coming to the hospitals, this is how we know now how to treat them. This is how we treat them in the ICUs. This is how we will treat them when we get them, if God forbid they are on a ventilator. And that also then reduces the death rate substantially.
Correct. So, it's a learning for all of us. When it started off in February, March, there was very little we knew about this virus, and we were using drugs which we are no longer using. We were using drugs which were for anti-HIV drugs, lopinavir, ritonavir, and there were other drugs which we were trying out because it was felt that they may be useful. Subsequent trials showed that they had no benefit. And then we started getting more and more data in, more and more studies in. We actually got to know more about the virus. We realized that this virus is not just causing a simple viral pneumonia, it's causing a lot of systemic manifestation. It causes what we call, the virus itself is cytotoxic. It causes injury to various organs. It leads to injury to the vessels, which leads to endothelitis and which leads to hypercoagulable state. It leads to clotting in various organs, including the lung, the neurological system. It can lead to myocarditis, and it leads to what we call the cytokine storm. Because we started understanding the pathophysiology of the virus more, we also started thereby changing our treatment strategy, and we realized that steroids work, and there's now a very good body of data which suggests that steroids in moderate to severe cases actually decrease mortality. We had data to suggest that remdesivir may help. It did not show a mortality benefit in the studies, although there was a tendency towards that. But it did show that you are out of hospitalization 4 days earlier. We also came to know that giving anticoagulants does help because it decreases the coagulation. So we have now got a more focused treatment strategy, and every day we are learning more and more as to how to treat it better. And I think that is also making a big difference, both in terms of mortality and in terms of ventilatory management. Our ventilatory management strategies have changed a lot from what we were doing initially. And therefore, that is also having an effect, not only in India, but globally, because our treatment protocols have actually evolved over time. And I think this will continue to happen over the next few months. And thereby, we'll get better and better in controlling the infection due to COVID-19.
So is this one of the things that you think perhaps can be the treatment protocol itself? Is there now a very clear treatment protocol that has been worked out? 80% of people, they can be treated at home or isolated at home, no problems, don't worry about it. These are the people who need to come to hospital. This is what you should do when they come to hospital. This is what you should do if they are on an ICU. This is what happens if there are serious cases. And maybe if that treatment protocol then is something that can be disseminated, because the next waves could come in places where the medical care is not that good. Maybe they're not completely following all the literature and are entirely sure of what to do.
So I agree with that, and this is something that we've been working on for the last few weeks, if not months. What we've done is, both on our website and on the Ministry of Health and Family Welfare website, we have put up the latest treatment protocol, which we keep changing with discussion and looking at the new literature. There is a new literature coming every few days. The Drug Control of India approved another drug, itolizumab, for cytokine storm. And then what we've started doing is we've also realized that often in smaller towns and cities, doctors are not aware of all of this. And therefore, we started twice a week holding what we call EICU consultations. And I hold that from AIIMS. We have now done more than 40 hospitals, more than 50 hospitals, as a matter of fact, across the country, who are treating COVID positive patients. We interact with the doctors, we discuss the treatment protocol, tell them that this is how you should do, and discuss the management strategies that they have. Today, we also did what we call a national COVID grand round, where we present a case and discuss issues in that case, and also have a little bit of a topic discussion. And we've got doctors from all across the country. As a matter of fact, it was heartening to see today that we had doctors even from Nepal and Bangladesh logging on to this to really listen to the talk and ask questions. So I think we are trying very hard to disseminate the knowledge, because I do agree that the knowledge is changing so rapidly that it is going to be difficult for people in smaller towns to know what is right. And sometimes they go by what is on WhatsApp or what message they've heard, and sometimes that can cause more harm than good. Some doctors may start steroid very early when it is not really required, or start antiviral drugs in mild cases when again there is no indication. So there has to be a protocolized management depending on where the patient is, in a mild situation, a severe or moderate situation, and drugs have to be used judiciously, because many drugs can cause more harm than good.
And you're absolutely right. It depends on when you do which treatment. If you start treating somebody with immunosuppressants, or for a cytokine storm, and the patient doesn't have that, you can actually, cause more harm than good. Dr. Guleria, a lot of people are very excited about the talk about the vaccines that are coming, the Oxford vaccine and others coming. And people are now, I think, starting to see some light at the end of the tunnel to say, okay, the vaccine will be there 3 months from now, 5 months from now. What's your own take on the vaccine? And do you think the vaccine is going to be with us soon, or do you think we'll figure out how to treat the disease itself in such a manner that maybe fatality will drop very fast even before the vaccine comes?
So I think in many parts of the world, the disease has really come down significantly and the fatality has come down. But to really eradicate it, because COVID-19 is going to be there for quite some time, it's not going to just disappear overnight. And therefore, a vaccine will help, because it will actually help to protect, especially the high-risk group. Because if you look at the high-risk group, the elderly and those who have comorbidities, the mortality continues to be high in them. And therefore, if we really want to protect them, a vaccine for them really will be a game changer. It may not be that useful in the younger age group, because there the mortality is very low, and it may not make that much of a difference. But I still think that it's a few months away that we can have a vaccine. The initial trial of the Oxford vaccine and the other vaccines have shown, the Moderna vaccine from US have shown good results in terms of safety. But we still need to look at the immunogenicity. How long does it last? Is it good as far as protecting us from the infection is concerned? So I think probably the vaccine will be available early next year if everything goes right.
Right. A couple of final questions, Dr. Guleria. You were talking about testing, and you're right. India has scaled up from next to no test to something like 350,000. But just as cases per capita in India are actually not in the top 100, deaths per capita are not in the top 100. Similarly, testing per capita, obviously, absolute testing, we are India's number 2 or number 3, number 4 in the world, something like that. But in per capita terms, obviously, it could be a lot more. How far away do you think that we can get a testing protocol done, and without some of the problems around specificity, which we are seeing in the antigen tests and others? So how far away from a position where we can really do mass testing and just about anybody who wants can go and get themselves tested and do that? Is that far away, or do you think we're nearly there?
So we're moving in that direction, and one of the aim is that very quickly we should be able to do at least 1 million tests a day. That is the aim that the government is moving towards, in terms of getting more and more labs, getting the kits available indigenously, and of course the rapid antigen kit, which is also very useful as a point of care test. Each test has its pros and cons, and it has to be used and interpreted properly. But I think the most important issue to remember is that, considering the size of our population, we have to see how we can best use our resources and the tests that are available. So we may have a time when we could say that anyone who wants to get himself tested can do so, but I still think that that is going to take some time. Currently, we should focus on those who really need to be tested, so that we are clear as what is the question that we're trying to answer. It shouldn't be that anyone who has a panic reaction should go and get himself tested, and thereby sort of use resources which are scarce. And I think, therefore, we should gradually open up our testing strategies so that we are able to really help in containing the infection, but we don't really misuse it, or people don't start misusing it and start getting tested when it's really not indicated. But I do agree that we have to really ramp up our testing much more, especially in smaller cities and in rural India, where, as we're noticing, the cases are increasing, and we have to have good testing capacity in these areas.
Right. Last question, Dr. Guleria, about what's it now? 3-4 months into the pandemic, and after 120 days since the lockdown started, I seem to be almost seeing two different reactions from people. One is a group of people saying, forget about it, we can't now deal with the virus anymore, let's go out, get on with life, let's not think too much about it. That's one extreme. And the second extreme are people who are still living in a state of fear and almost in a state of panic about coronavirus, with that, if something happens, what's going to happen, the issues of stigmatization. What would be your message to people who are watching this? How should they view coronavirus? Obviously, they should take basic precautions, wash their hands, wear masks, social distance. That's obvious, I think, and that should remain obvious. But what else? What other advice would you give to people?
So I think we still are in the middle of a pandemic, so we have to be cautious. I do agree with you that there are a lot of people who just have got really frustrated because it's really not the life that they would like to live. But I think it's just a few more months, and people should be a little bit more patient, because currently the number of cases are increasing. And although the younger age group feels that if they can go out, even if they get COVID-19, it's going to be a mild illness, it's important to remember that many of them can bring it to their house, and you may have elderly there or people with comorbidities, and it can cause a serious illness to them. So I think we still need to be very, very cautious, especially in areas where cases are increasing, but also in areas where there is a decline. Sometimes I've noticed that people feel that now the number of cases in our city has come down. That means we can really forget about wearing masks, we can forget about social distancing. And that has actually led to a resurgence of cases, or a spike in the number of cases in that city. So as the lockdown gets lifted, the responsibility of each citizen becomes much more in terms of social distancing, in terms of maintaining all the precautions that we've been sort of propagating for the last few months, and also protecting the high risk group. Because if we want to keep our mortality down, then we have to make sure that they are protected from getting COVID-19 till we have a vaccine.
All right. Randeep Guleria, thank you so much, sir, for joining us. It was a pleasure talking to you. Thank you.
Thank you very much. Always a pleasure. Thank you.
Rujuta, perhaps I could just sort of start with you. Look, when you're thinking about coronavirus and people are worried about, when you're thinking of health at a time of coronavirus, people are saying, don't get the virus, don't get infected, don't go into an ICU. But that's not all that there is to it, right? Because for a lot of people, like for the elderly, they've not perhaps been able to step out now for 110 days. They've been inside their house. There must be food concerns, nutrition concerns, exercise concerns, lots of other aspects of their health. Maybe they're not being able to go for regular checkups. Maybe they've not been able to do their diabetes check or blood tests that they may have wanted to do. There must be lots of other ramifications of this beyond just COVID itself.
Yeah, and I think to some extent, families are trying to address that. I think I have seen more Zoom birthday parties and Zoom meetings and bhajans than ever. I know of spiritual discourses being done over that. I also know that Niti Aayog tried to reach out to the elderly population with what one could do in terms of food, nutrition, exercise, mental health, or all of their medical aspects too related to NCDs and stuff. But yes, I think this is going to take, and it has been taking, a much bigger toll than just what the virus can do. There has just been so much talk around immunity. I've been working in the field of food and nutrition for over 20 years. And the only thing that I've been talking about is weight loss, fitness, size, and stuff like that. All of a sudden, over the last few months, everyone wants me to talk about immunity. It's like we've never been so concerned about our health. We've never been so concerned about our immunity. We've never really been concerned about health as an entire spectrum like the way we are now. So though it comes with a whole lot of problems, I also feel that the pandemic has come out with opportunities to actually redefine what health means, going beyond the weight and size. Also redefine what healthy cooking means. It's not something which has X amount of carbs and some protein and some omega-3 fatty acids, but actually something that you're cooking at home and sharing together as a family. So I think that we shouldn't miss out on the opportunities that it has thrown up.
I before I move on, I just have to ask you, I want to discuss, exercise and how people are staying fit and if they are staying fit in the middle of all this. But you mentioned immunity. So I've got to ask you, because I don't think for 120 days, a single day has gone by when somebody has not on WhatsApp sent me some message saying, ye khao tumhe coronavirus nahi hoga. And I don't know why, maybe I'm just skeptical by nature. Something tells me 95% of that is probably a hoax, right? Is that really something which you can do to ye khao and coronavirus nahi hoga? Maybe some of it is more true, eat healthy and zinc tablets or whatever.
Well, I just think it's like saying ke shadi kar lo to pyar ho jayega. It's one of those kind of things. You need to look at immunity as something that you do on a daily basis, and you are committed to leading a healthy lifestyle forever. That's how immunity or health or good shape, fitness, glowing skin, or whatever else that one is looking for is built. It doesn't come out of a bottle. It's not something that, now that it's the big hashtag topic of like immunity or immunity booster or whatever, that I'm going to open a zinc tablet, a calcium tablet, an omega-3 tablet, a vitamin C, and everything's going to get all right with me. I do know that chemists have run out of vitamin C stores, so vitamin C tablets. That's the kind of mad rush that we are having for just popping pills. But immunity is not something which comes out of a pill or a potion or an app or a product. It has to be something which is more commonsensical. Wake up on time, sleep on time, have a routine, even if you're not going to office. Eat at home and work out at least for 20-30 minutes every single day, even if it's just a couple of Surya Namaskars that you're doing daily. So, but common sense will not make it to a WhatsApp forward. It's poor for business. It's not something that one can sensationalize or talk about. So you're absolutely right in being a skeptic with all those WhatsApp forwards. You've got to go with your gut and common sense at all points of time.
Stick to the common sense and stick to all the good old things that people have been telling you all this time.
Yeah.
Eat healthy. Dr. Parikh, I really wanted to get you in on this entire, on the mental health aspects of it. And, there are people who are still locked down for a very long period of time. They're facing stress. And some of the people who are locked down, for young kids, for example, it must be very, very challenging. How do you deal with it? You're dealing with school entirely remotely. And for the elderly who've not been able to step out. Are you seeing lots of accelerated and aggravated mental health issues during coronavirus?
Vikram, let's understand this. The fact is that we've experienced the most unprecedented aspect of our life, which we've never heard about, never talked about. We've probably read about it here and there, the Spanish flu, the bubonic plagues, and so on and so forth. But fact is, none of us was prepared. None of us is prepared. It continues to be an evolving situation. And uncertainty is very much a norm at this moment as we speak. Both you and I do not know, let's say, when will colleges start. We don't know how safe and when would be public transport be okay. And we are aware of the fact that economy has taken a hit. We are aware about the fact that lots of people are going through financial issues, primarily because of pay cuts, the job scene. One has to understand that lots of children have gone through stress with not knowing when the exams would happen. Now that the results have just come out, they don't know when the next semester starts. Some kids would have wanted to go overseas. They don't know what will happen. The NEET exam, we still don't know how it will happen. So if you just look at the various aspects of our lives, and even if you start opening up, it's not that the people are just going to start going out without apprehensions. The fact is, anxiety is there. The fact is, we've gone through a very, very unprecedented stress. These are facts. So somewhere underlying this entire physical pandemic of COVID, there is a lurch, I worry, of a mental health epidemic, in the sense that the stresses, the struggles, right from the economy to lifestyle, Rujuta rightly was talking about when she was talking about sleep. I have so many people who talk about how their sleep has reduced, and I tell them it's okay because your lifestyle has changed so much, you don't need the amount of sleep you needed. People come and talk in terms of the digital fatigue. And I tell them right now, you'd rather have the digital interface than think about a digital detox, because that's the only thing that's keeping you connected with the world, right? Children have gone through their own stress. Elderly are struggling because you're quite right, they haven't stepped out. And I have 4 people above the age of 80 at home. And, I haven't let them step out since the day we were hit by the virus, and no matter what happens, they can't go out. So these are realities. And because there is no clear-cut timeline, there is an underlying stress. There is a fear of the illness and of the consequence. In that light, the fact that mental health concerns are there, an increasing number of people are talking. I've taken, frankly, more corporate, school, public sector engagements in the last 120 days than I've taken probably the last 2.5 years. Yeah. Because everybody wants to know what best they can do. And we have to accept it. Nobody has the right answer. We try in our sincerity to do what best we can. And I've been telling people there's only one way forward. Focus on one day at a time, Vikram, just one day at a time. Think about today, don't think about tomorrow. Yeah. And for today, you have to look at only 3 things: positivity, productivity, connectivity. You stay productive the best that you can do. Don't compare to pre-COVID days. Stay positive, because that's in your control, and stay connected. If your support systems are with you, you'll come out of this comfortable.
Okay, those are some really interesting insights, and I'm going to come back to you again and talk a little bit about that. But Ajit, if I could just turn to you. One of the points that Dr. Parikh is just now referring to about the financial stress. Now, I know that many have been telling people all these years, save up for a rainy day. Some people may have done it. A lot of people, unfortunately, haven't done it. And this is as bad a rainy day as you could have ever, imagined. A lot of people without their livelihood, without a job, MSMEs that are struggling, not knowing how to pay their bills. It's actually been a very, very tough period. What is the sort of insight that you're getting? How many people are facing, to your mind, severe financial stress to go with whatever other physical stress and mental stress that we were just talking about?
So it's quite, Vikram, across the board. I don't think that there have been any specific studies done in the last maybe 100 days to exactly pin down, what is that stress and how many people are going through it. Of course, we see the migrants walking back home, and that a large segment of people have been affected there on one side. And, just to put it in perspective, out of 130 crore population that we have in India, about 44 to 47 crore is the working population. And almost 50% of them earn 5,000 rupees a month. And because most of them could be casual laborers as well. And that's where the impact has been, maximum. And it has been the same also in offices. In fact, I read a small survey that was done by HelpAge, which was referenced by Neil and Nilanjana in the Hindustan Times, the Mint newspaper, talking about people above the age of 60 being laid off. And there was a large proportion of that, almost 60% of the people that they surveyed, about 5,000 of them, had been laid off a job. And it's very difficult to then, recover incomes or get another job at that stage. So the stress is real, and it's human endeavor really to try and control your circumstances, and financial circumstances do lead a lot to stress. For PGIM India,
it would be clear cut. See, you are 100% correct in saying that there were a certain section of the population which is obviously going through a lot of financial stress, and I think a lot of the government's efforts were also aimed at them, right? Make sure that 800 million people have food and some sort of ration is taken care of, and there's a visible concern. But it is also possible that there will be some people right now who will be facing financial stress whom you wouldn't normally think or associate with financial stress. Restaurant owner, somebody who's got a small business, you think they're okay. They're middle class, they're maybe even upper middle class. Some of them may even be rich. And suddenly they are finding in these 3-4 months their business is shut down. They don't know how to pay their salaries. They have home loans to pay and all of that. So it is possible that the stress of that financial crisis is hitting people whom you normally wouldn't associate with financial problems.
Yes, that's absolutely true. And, anecdotally, as we speak to people within our office and extended friend circles, you do hear about that kind of a stress that people are being with, especially in small businesses, Vikram, as you mentioned earlier, that's been the toughest. Now, the insights that we've had, Vikram, here, and for PGIM India, our parent Prudential Financial in the US have done various studies and have figured that this stress does impact, as Dr. Parikh said, it impacts productivity, it leads to absenteeism, it increases health costs. And therefore, having a control over this financial or getting to financial well-being from our perspective has been a couple of simple things. One, getting a control over managing your day-to-day finances, having the behaviors that you can adopt to manage your day-to-day finances, having a sense of achieving your goals, your financial goals, and 3, about protecting from financial risks. Just those 3 aspects that one needs to be sort of thinking about. We ourselves in PGIM India did a couple of studies last year, which we haven't published as yet, very soon to publish. And one aspect of financial well-being and financial security, Vikram, that we came across as an insight is that people who are in joint families feel more financially secure than those who aren't in those large families. Of course, nuclear families are a thing now, urban living. But this was one aspect that came through in our study, that if you're connected to your family, if you're connected to a larger circle of your close family, you do get a feeling of better financial security than if you're alone and trying to manage all of this.
That connection and that sense of, that's exactly the connection community, Dr. Parikh, you were talking about before I come back to Rujuta. So that support system and that social support system, to your mind, would it be one of the most important things, not just about financial security, but in bringing a certain amount of mental peace as well, Dr. Parikh? And also, to take off from the point that I was just asking, Ajit as well, is it possible that there are a lot of people who till now have not shown any signs of anxiety or depression or any forms of mental challenge at all, but suddenly are facing a lot of that challenge, and therefore that might be something that people need to be concerned about?
Yes, Vikram, I think that's quite the case actually. Like you mentioned, that we look at the more obvious financial impact and don't realize that a lot of other people whom we wouldn't think are going through financial stress, the same applies to the mental health component as well. 2 aspects. A lot of us either are not able to express, more importantly, we don't know, Vikram, what would be the outcome 6 months down the lane. So it's not merely about whether you or I are going through significant emotional or mental distress now. Now maybe you are trying to fight it out, you are trying to solve issues, you've taken a goal setting kind of a role, you're driving your family or your business or your work. But once we are out of this, that post-fatigue, when the new reality sinks in, we do not know the impact of mental health that will happen there. But I must endorse very, very wholeheartedly what you just mentioned, that joint family systems. And I think that's the core here. Support systems are going to be the key between people who will have positive mental health outcomes and those who do not. We've always made the mistake of comparing a functional nuclear family with a dysfunctional joint family and thinking that it doesn't work. But if you compare a functional joint family with a functional nuclear family, then you realize that how that support system makes a difference. Whether it's in taking child care, senior citizen care, pooling in of resources, or the mere support that we are all going through a crisis, but we are all in this together, we'll pitch in. And that's why I mentioned connectedness. And we are all fortunate that we are in this era where we have these 4Gs and 5Gs all around us.
Yeah.
Imagine 50 years back, how would you have even communicated? At least you have video calls available. You can reach out to an alumni or school friend, a distant cousin, get connected, share positivity. And for once, statistically, I think trolling is less, if I'm not mistaken.
Yeah, I've had people, looking at me, including elderly people, 81, looked at me and said, in a sense, I'm glad the coronavirus has come now. At least we can talk, we can FaceTime, we can see your face. If this had happened at another time, it would be far more challenging. I guess one of the problems, of course, is that, yes, family systems can be a support. Must be more, I think once all of this is over, done and dusted, we may also hear some horror stories of dysfunctional families where domestic abuse and others happening. And maybe that has skyrocketed or spiraled, and we'll only come to terms with it a little later. Rujuta, if I could just come to you next on, obviously some of the precautions that people should be taking, and you were referring to some of it: eat healthy, exercise, meditate. A lot of the things that you and others, I'm sure, have been telling people for a long time. But what is your sense? Are people doing more of it right now because these are such troubled times? I mean, are people, for example, exercising? It's a joke that after 100 days of lockdown, many people may not be able to walk out of the door, right? After those 100 days. That's a theory. Now, anecdotally, I'm seeing that a lot of people, including myself, perhaps are fitter than we've been ever in our lives till now, for the simple reason that because you're there, you feel this, you say, okay, let me try and exercise, let me get some time to go out and actually do something. What's your sense? Most people are being well behaved or badly?
I think most people are behaving better than ever. A lot of them who used to travel like crazy and would need to take early morning flights and stuff, I think this big break has actually allowed them to optimize on their sleep. It's allowed many families to eat together, and I think that has also helped people. It's also allowed families to see how male members were almost forced, into kitchen and household tasks. And I think that has also brought in a better sense of balance, with a whole lot of men discovering that they aren't such bad cooks. After all, you find more posts which are, where with women appreciating their husbands or their children, when it comes to lending a helping hand at home. So I feel overall, and this is something that I've been saying right from day one of lockdown, because we even started a project saying lockdown learnings, where we would do videos about small things that you could do at home related to food and exercise and well-being that would keep you healthy. That though there was this fear that one is going to get fat, the exact opposite was going to happen, because this is the one time that you actually, at least all those who are privileged, have the time to focus on themselves, to really eat on time. They're no longer delayed lunches, they're no longer late night parties or early morning flights. Just the fact that you have more time to yourself and to your family, I think it's worked wonders. People have been waiting for bookshops to open, so they're reading more books. They're actually self-regulating how much time they spend watching mindless serials. They're asking each other for, they're asking for recommendations so that they know that they're just watching something that they would be happy watching. I think more time on hand has overall turned us into a fitter population. Almost everyone that I know is exercising in one way or the other, or at least staying more active than ever.
Okay, that's really interesting, because when we think about the dark side of the pandemic, and obviously there's been a dark side, but there are also other aspects of it. For starters, the air, right? The air that we have breathed for a long period of time has probably been much better and much cleaner, and the rest of it. Dr. Parikh, on those connections that we were just talking about, taking off from what Rujuta was saying, that it's not, obviously there's been a downside, but in some ways, maybe people have found a different way of doing things. Do you think it is possible that some of the lessons we will have learned as a result of these 100 days or 150 days or however long it is before it ends, may in the long term actually make us realize certain other values? The value of family, the fact that the families are spending so much time together and are saying, it's not been as bad as we thought it might be. The value of saying, okay, let's eat. You're getting into the habit of exercising and saying, okay, I'm going to exercise now. I like it. People have started meditating and saying, okay, I actually enjoyed this. Maybe I'll keep on doing it. actually, as Rujuta was saying, I really didn't enjoy the amount of traveling that I was doing in all those fights I was taking, and can I avoid this? Is that possible that at the end of the day, we will learn lessons about ourselves and the world that paradoxically may end up making us happier or more mentally stable people? It's a tricky question and tough to say. It depends on how long it lasts, how many days we're locked down for, and just how bad the pandemic gets, I guess.
Two sides to it. There is no doubt about the fact that we have learned, whether we like to learn or not, but we have learned. We have learned minimalistic living. We have learned the value of connections and family. We have learned that we can manage ourselves with a lot less than what we thought we could. All that is true. There are way too many stories of altruism where people have lent support to people around. There are lots of positive stories. I think the entire work done by healthcare workers across the country is absolutely overwhelmingly, humblingly mind-blowing. When I see my colleagues exposing themselves and their families and the kind of effort that goes in, it's just unbelievable. I can tell you from own personal experience, one fine day I was entering our hospital and Arogya Setu changed the color. And at that time we had a norm that one had to test. And Vikram, I was standing in our flu clinic in our own hospital waiting for my test, and I realized that how anxiety provoking it would have been for everybody else. And the only thing that was on my mind was, I have 4 people above the age of 80 at home, others, and I've been seeing people and friends, my colleagues at work. What if it comes positive? The impact on them, and it did had an impact. Fine, it turned negative and one continued doing what one does. So yes, we have been exposed to learning opportunities. If you are an eternal optimist, then you can hope that mankind version 2 post-COVID will be a better version of itself. And I sincerely hope it's a version of values. But if you've seen the way we have been living for the past 2-3 decades, and with the stagnation, the degeneration and the deterioration of almost everything around us, where means really have stopped mattering, ends do, our portrayed self and social conformity has taken over everything else. Our vested interests drive us a lot more. Values have taken a beating. If COVID actually changes us, I would like to be in a place where I'd rather have mankind surprise me and become better role models for generations to come. But we'll have to wait and watch, Vikram. We are highly capable of, the moment we are out of COVID, highly capable of not stopping at the red lights again, and starting the drunk driving, and starting the MMSs, and starting the trolling, and starting the cyberbullying. We're highly capable of that. I just hope somewhere it strikes a chord. There was a learning opportunity. We either take it or we lose it all over again.
All right, that's really well put. But I hate to tell you that people in Delhi, on the rare occasions I've stepped out, still driving badly. So that's not really true. Ajay, let me just get some final thoughts from you. Which way do you think this is going to eventually shape us? And, this is a very interesting thought process, whether we'll all end up being, in some way, as individuals, as humans, our long-term well-being, our long-term, how we will adjust ourselves to whatever is happening, and how we will adapt to the changes that have been brought about it. What is your sense? Will we eventually have a better work-life balance? Will we eventually have less, insecurity about life? We tell ourselves we've been through COVID. What else could happen?
So, Vikram, I think that at least in the friend circles that I'm talking to, I can see that a lot of, good habits have formed as you've been in the lockdown state. As Dr. Parikh said, you're realizing that you're saving more money because you're not entertaining, you're not going out, and you're eating home food. And as Rujuta said, some of those commonsensical things actually playing through. So I do expect that, as far as financial well-being is concerned, this has definitely been a huge wake-up call for a lot of people. And people will be looking for answers and looking for help in terms of what are those things that they can take care of now so that they don't have to face something like this again. And wherever we've been interacting with, clients, Vikram, we've been telling them that, just go with simple thumb rules of what you should be knowing about managing money. One that I like of Morgan Housel of the Collaborative Fund, where he puts it very simply to say, spend less than you earn, save the difference, invest in a diversified set of solutions, have patience. That's like a 4-step rule of saying that that's what you take. I do think that, one step before that is to realize that there is a sequence to financial well-being. As you start off work, for instance, it is always insurance and protection that is the first step, because you are trying to, you don't have big savings with you. So you're trying to make sure that if something happens to you, your family is not left with loans and, other liabilities. So you take care of your insurance first. The next step, as your savings do increase a little bit, is to create an emergency fund. And I think the need for an emergency fund has been felt the maximum with this crisis upon a lot of people. I talk to a lot of my advisor friends, and they say this is the conversation that they're having, that let's have an emergency fund. And then you the third step into investing or wealth transfer, making your will and things like that. But I do believe that one way that we would recommend to people is, in obviously educating yourself. Health and wealth are two aspects that any self-respecting adult should know. And Vikram, it isn't taught in schools. We become adults, and then, we listen to our friends, peers, and then we stumble into some aspects of this, for sure. And the one other big aspect is prioritizing financial goals, Vikram, which we think is very important. And in India, for instance, retirement is not a priority because, either you feel that, your children will take care of you, or other aspects of your financial goals are first. But just think about this one insight. You can get a loan for every single financial goal of your life except for retirement. So you want to get married, you want to go abroad, you want to set up a business, you want to buy a house, car, whatever, you get a loan for it. For retirement, you can't go to a banker and say, I need a loan, I'm retired. Though you have things like reverse mortgage, which, people don't use as much. So prioritizing on these goals also is, I think, an important step.
So those are some simple lessons for financial well-being to think about during these months of coronavirus and pandemic, which is that you have to give 3 or 4 items of advice to people for physical well-being, takeaways from this, somebody who's watching this, what should they do for however much longer this continues?
Well, I really think that, during this lockdown, we focused a lot on what we can do as people to stay healthy, whether it is eating right or sleeping on time or regulating how much time we spend watching TV and stuff like that. But I think now we also need to get much more sensitive to the whole spectrum of health, even as a public or, as a republic. We need to be asking for cities to be built with green spaces, to be built with proper footpaths and cycling tracks, so that in the future, should we have something like this, we are at least able to go out safely and walk or exercise as a default mechanism. See, currently in urban India, not exercising, being in the car all the time, double parking and stuff like that is a default mechanism because as one gets more affluent, one feels like that's a safer way to go around the place. And what we are recognizing now is all of these things, not exercising, not going out in the open, not eating your food at home, eating more packaged stuff. This is exactly the stuff that makes us obese. And once you have obesity and all of the non-communicable diseases that come with it, then you're that much more vulnerable to any virus or any new organism, that may come even later in the future. I mean, we do know right now that the ones who are at a bigger risk are the ones who are obese and are having NCDs. And if we have to prevent that obesity and NCDs, then we will need regulation on packaged and processed food. We will need footpaths and open spaces. We will need high rises to be built with bigger parks and lesser car parks. I think we need to now demand for those things much more actively. It needs to become more mainstream and not really be thinking about health just as an individual responsibility. Even our healthcare systems, like Dr. Parikh was saying earlier, that we are overwhelming the doctors because actually we were never prepared for this. And it's not that we didn't have the time to build this. So now that we have been forced to face our shortcomings, I think we just need to have a focused approach and build everything that's needed to stay healthy.
All right, last quick word on this program from you, Dr. Parikh. One mantra for mental well-being to follow for the next 1 month or 2 months.
Prioritize mental health at all levels. Media needs to continue to speak about mental health and raise the bar of awareness. Entertainment media needs to be responsible in portrayal of mental health. Social media needs to become a positive place. Government agencies need to ensure that the right messaging and the right help reaches to the vulnerable. Corporate India needs to prioritize mental health outcomes beyond the P&Ls and EBITDAs. And the bottom line is, a pandemic is pan. It's about everybody. It's not about an individual problems, individual approach. What we truly need is collectivism, connectedness, altruism. And when that comes together, that's where we'll be able to take care of ourselves, the society, with a sense of responsibility. And we owe it to the next generation. We've been horrible as role models. This is one opportunity to show paths to the youth, or just let them take it forward so that they do a better job than what we've been doing all these years.
All right. Well, thank you so much, all of you, for joining us. It's been really interesting, and I think all of us have got some very valuable insights as how we should approach the entire question of well-being and health at a time of a pandemic. Thank you all so much for joining us. Bye for now.